Hi guys, welcome back to the channel. In last class we have started distributive shock, in which we have dealt with anaphylaxis and neurogenic shock. Today we'll be starting septic shock. So let's start. Septic shock, it has the increased mortality rate. Septic shock has increased mortality rate. What happened in septic shock? I'll describing this in brief, then we'll deal this with in detail, because septic shock is very common. Okay, release of endotoxin from gram-negative bacteria, which leads to activation of cellular and humoral component, which in turn causes vasodilatation with hypotension, low systemic vascular resistance, inadequate afterload, abnormally high cardiac output. It causes vasodilatation with hypotension, and which result in abnormally high cardiac output. This is a brief what happened in septic shock. Okay, in later phase, septic shock causes hypovolemia, which increases the vascular permeability and decreases the blood volume. Okay, treatment: elevation of leg, administration of fluid vasoconstrictor drug. Okay, treatment also will be dealing in detail. This is not only the treatment, various other drugs are also used. So this is just a brief that in any shock we can use this elevation of leg, Trendelenburg position, which we have read in last class. Okay, and administration of fluid is important because in later phases it causes hypovolemia. Okay, and drugs will deal in detail about drugs. Now coming to what are the common organism of septic shock. Okay, E. coli, gram negative mostly, Klebsiella, Proteus, Pseudomonas and bacteroids in order of decreasing frequency. Okay, most common is E. coli and least common is Pseudomonas and bacteroids. Okay, these are the organism causing septic shock. Gram positive sepsis and shock caused by dissemination of potent exotoxin liberated from gram positive bacteria without evidence of bacteremia. Okay, in there is no evidence of bacteremia. When gram positive sepsis and shock occur, there is no evidence of bacteremia. What are the example? Clostridium tetani and C. pefringens. Peculiar feature: no reduction in cardiac output even with hypotension. Hypotension होता है लेकिन cardiac output नहीं डिक्रीज होता है. We have read like अभी कि जब हम आपको ब्रीफ में बता रहे थे तब ऐसे it leads to abnormally high cardiac output. Now gram negative sepsis and shock. Source is genitourinary system, respiratory system, GI tract disease. These are the source of gram negative sepsis and shock. Okay, gram positive sepsis and shock, gram negative sepsis and shock. In gram positive sepsis, there is no evidence of bacteremia. Okay, there is no evidence of bacteremia. Now, what are the clinical features? Initially, by the development of chills and elevated temperature above 100 degree Fahrenheit. There are two types: early warm shock and late cold shock. Early warm shock and late cold shock. What happened in early warm shock? Cutaneous vasodilatation. Toxin from infected tissue increases the body temperature. Decreased systemic vascular resistance and arterial blood pressure. Okay? Cutaneous vasodilatation. Toxin from infected tissue increases the body temperature. Decreased systemic vascular resistance and arterial blood pressure falls. BP low हो जाता है. And late cold shock, due to liberation of toxin substance in central circulation, increased vascular permeability, which leads to hypovolemia and decreased right heart filling, which leads to decrease in cardiac output. This happen in late cold shock. Early warm shock में क्या होता है? Vascular resistance decrease होता है और BP fall हो जाता है. और late cold shock में क्या होता है? Vascular permeability increase होता है, hypovolemia होता है और cardiac output decrease हो जाता है. This happen in late cold shock and this happen in early warm shock. Okay, that's all for today. Next class we will be dealing with treatment and will be ending septic shock in next class. Till then, bye. Like, share and subscribe.